All right, Jamie, we're continuing our house calls tonight with Dr. Shweta Kurian, a medical oncologist and hematologist with MedStar Health. Doctor, thank you so much for coming back with us.
Thank you for having me.
So we're talking about the risk factors in terms of breast cancer. What is the average risk for breast cancer, and then what is a high risk for breast cancer?
So if we look at a general population and calculate something called a Gale risk, we give around 0.8% as being the average risk for breast cancer. And then anytime it goes above 1.7%, we say it's a higher risk for breast cancer. Now, having said that, what is Gale risk? You calculate it by putting in certain parameters. You look at the age of the person, family history, if they've had any previous biopsies. We look at when was their first menstrual cycle, when was the first live childbirth, and what is their ethnicity. And that's plugged into a special calculator that calculates and gives a risk, saying this is your risk for developing breast cancer over your lifetime. We generally start doing that at age 35, but there might be some people, their risk may be higher just because of their genetic susceptibility. If they carry a specific mutation like BRCA mutation, BRCA1 and BRCA2, their risk for breast cancer is much higher, up to 80% sometimes over their lifetime to develop breast cancer. Some patients may have higher risk because they've received any radiation in the past when they were younger. And so, or sometimes people have had previous biopsies which show specific pathology, something like a lobular carcinoma in situ or an atypical hyperplasia, which are things they see under the microscope, and then they can identify, okay, yes, exactly. Those are very typical. They're very specific things that they see under the microscope and tell us. The pathologist looks at it and tells us, okay, this biopsy looks very weird, this is the thing, and they are high risk for developing breast cancer down the line.
So if you're high risk, what are your treatment options?
So depending on your risk, let's say you're someone with a high Gale risk, you will be referred to something called a high-risk breast clinic that we have at Franklin Square Hospital. These patients come in and we talk to them about decreasing their risk by using medications. Depending on your risk, you could take something like a medication which decreases the estrogen exposure over your lifetime. Tamoxifen and anastrozole, these are medications which can be used to decrease your risk. If you are someone who has a mutation, like a BRCA mutation that increases your risk, then we talk about other procedures that can be done to decrease your risk for developing breast cancer, or seeing other specialists that can help at least identify breast cancer or other cancers that may be in part of that syndrome of the mutation.
So you hear about mammograms. Are there other screenings other than mammograms and the self-breast exam?
That's true. So of course, self-breast exam monthly by the patient, mammograms yearly, and patients who have higher risk can also undergo something called an MRI of the breast yearly.
Okay. All right, Dr. Kurian, thank you so much. One of our many experts taking your calls from MedStar Health. The number to call is 410-671-0702. And this year we're going to be here with you until 7:30 tonight. Jamie Costello.
All right, Doctor. Intern Swoop, thank you.